Over to you, Mary.
Okay, thanks a lot, guys. Well, we have Dr. Christian Capener here from Riverton Hospital out in my neck of the woods. It's good to have you here. And you're a gastroenterologist, and that means you specialize in the colon.
Yeah, the colon
The
is
whole gastro system.
exactly. We take care of the esophagus, the stomach, the small intestine. The colon is one part of the intestines that we take care of, as well as the liver. So we specialize in all those things.
And why is a colonoscopy so important?
Well, screening colonoscopy is important because colon cancer is actually a very common cancer. Most people don't realize that colon cancer is the #2 cause of cancer death in the United States, second only to lung cancer.
Right.
And it's equally common in both men and women.
Right.
I have a lot of female patients that ask me, do I need to get a colonoscopy? And the answer is yes.
Yes.
Now, most men tend to get advanced polyps more frequently than women do. But women tend to live longer than men, and so their lifetime risk is actually equal to men.
It's equal.
Yeah,
okay.
so that's,
and it's the same age. It's 50.
Yes.
As soon as you turn 50, you need to get a colonoscopy, and then the doctor will tell you, come back in 3 years, come back in 5 years,
yes,
if everything looks good. And if you find a polyp, what happens?
Well, that's the key. What we're trying to do is prevent colon cancer. So unlike other major cancers like breast cancer, for example, and prostate cancer, colon cancer can be prevented. And the reason for that is small polyps usually develop into cancer over several years. We don't know which polyps will develop into cancer and which ones won't.
So you just take them out?
We take them out and we send them to the pathologist, and the pathologist gives us a report and tells us what they have found.
And they either say, yep, it was cancer, you got it, or no, it wasn't.
Yeah, hopefully not, but what they'll tell us is what kind of polyp it was.
Right.
And then depending on the number of polyps that you had, the size of the polyp, and the pathology of the polyp will determine whether you follow up, usually within 1 year, 3 year, 5 year.
Right.
If there are no polyps and you have no family history, then you follow up in 10 years.
And they tell you right as you're coming out of it, they say, oh, everything's okay, here's a picture, look what we found.
Yeah.
Because I've been there, so
Right.
yeah, no,
Absolutely.
it's fantastic. And definitely get your screenings. Any family history, start at 40 instead of 50.
Yeah, the family history is a little bit tricky.
Yeah.
If you have a
Just
family
ask.
history.
We're already out of time, so
okay.
I'm just trying to badger them into getting their
Okay.
screenings. Thank
All
you
right.
so much,
Yeah,
Dr.
no
Capener,
problem.
for coming in.
You
We'll
bet.
be right back.